Yes.
Hi, Mrs. Meyer. How are you doing?
I'm okay.
Good. My name is Tage. I'm going to be your nurse today. I have orders to put a catheter in you from your doctor. Did he talk to you about that?
Yeah, I explained it. Yeah.
Okay, awesome. I'm just going to check your wristband here. Can you give me your name and date of birth?
Dina Meyer, 5/31/88.
Okay, perfect. And do you have any allergies?
None.
None? Okay, good. All right, so I'm going to perform hand hygiene. Okay, so I have performed hand hygiene and I have my clean gloves on. I'm going to open the catheter pack and open up my sterile field. Okay, next I'm going to take these gloves off and perform hand hygiene, but not turning my back on my sterile field. So I'm going to take the sterile gloves out. With my non-dominant hand, I'm going to pick up on the folded part of this and place my dominant hand inside the glove. Now with my dominant hand, I'm going to go under the fold of this glove. And put my non-dominant hand in. Now I am sterile. Trash. So I'm going to pull this out and place it under my patient. Next, I'm going to take the drape out and place it over my patient as well. All right, so I'm going to open the iodine. Once again, I've made sure my patient doesn't have any allergies, especially to iodine, and drop it. I'm going to place the lube for the catheter in the kit and drop it into the trash. And I'm going to take the catheter out, being sure that I don't flip the end of the catheter anywhere and I keep it sterile. I'm going to lubricate it up and let it sit in the lubrication while I get ready to clean my patient. All right, Mrs. Meyer, I'm getting ready to clean your urethral area. It's going to be cold. I'm going to use some iodine swabs, okay?
Okay. Okay.
So I'm going to spread the labia. I'm going to take one iodine swab the right side from the top of the urethral area down to the bottom. I'm going to take another swab and go from the left top down to the bottom. And the last swab I'm going to take and go from the middle down to the bottom. Okay, next, with my sterile hand, I'm going to grab the catheter, making sure that I'm generous with the lubricant because this can be very uncomfortable. Okay, Mrs. Meyer, I'm going to insert your catheter now, okay?
Okay.
It's going to be a slightly discomfort, but it should not hurt too bad, okay?
Okay.
I'll try to be quick.
Okay, thank you. Ow, okay. Okay.
Almost done.
Thank you. It's not too bad.
Good.
Are we there?
Yep. So by this point, You should see some urine. And I'm going to document that I have 10 mils or cc's of water that I'm going to be inserting into the catheter bulb.
Okay, it feels fine. I'm okay.
Okay, so you might feel a little bit of pressure as I insert this water,
Okay.
but it should go away pretty quickly.
Okay. I'm good.
You're good? Okay, very good. Okay, so I got all of the water inserted into the balloon. Now I'm gonna check for placement as I pull the catheter.
Oh, I feel it.
Yep, okay, so it is placed correctly because I did feel where it stopped because of the bulb, so it's not going to be coming out of the urethra. So next, I'm going to take all my sterile gloves off, perform hand hygiene, and I'm going to put new clean gloves on. All right, now Mrs. Meyer, I'm going to clean up around the catheter. This iodine can be kind of messy, okay? You're very welcome. So I'll have wipes and I'll be cleaning, like I said, a new wipe every time, just like the iodine sponges. And I'm going to go from the top of the urethra down to the bottom. I want to do this on females to not bring bacteria from the anus up to the vagina or the urethral tract. So I will clean her up. I will get all of this situated before I leave. I'm going to hang the catheter bag on a non-movable part of the bed. And I'm going to hang it below the bladder because you never want to hang it above the bladder. So I'm going to hang that and I will clean up my area. All right, Mrs. Meyer, do you need anything before I head out of here?
I would like a Dr. Pepper.
Dr. Pepper?
Extra
All right.
ice, please.
Okay, perfect. I will grab that for you. Do you need any snacks or anything?
You know what? Graham crackers with peanut butter.
Okay, perfect. I will grab that for you and I will be right back, okay?
Thank you. You are wonderful.
Thank you. So as I'm leaving, I'm going to perform hand hygiene. I'm going to check to make sure my patient's bed rails are up. The bed is in the lowest position possible. They have their call light and their remote. I'm going to go grab her a drink and some crackers. I'll be right back.